Welcome all. So today we're going to discuss on nerve findings both on clinical as well as on ultrasonographic examination and how it would help us to make a diagnosis of neuropathy, especially in case of leprosy. Now, this is an image of the left radial cutaneous nerve in one of our patients. As we see, the arrow points towards a thickened and cord-like structure. So the nerves generally are non-palpable, or in thin individuals it might be palpable, but in case of leprosy they become thickened, cord-like, very firm, and in most cases tender as well. Similar here, we see an image of the left ulnar nerve just behind the medial epicondyle in this patient. We see this bulge, and on palpation it was found in fact to be that of the left ulnar nerve. Here we see this very dry patch of skin behind the left leg of this gentleman here, and the arrow in fact points towards somewhere close to the tendoachilles tendon, but on palpation, in fact, it was confirmed to be an enlarged sural nerve. This is something which we commonly see when we deal with leprosy patients. So this is an enlarged greater auricular nerve, and it is better seen than felt. Here we see images of the common peroneal nerve, which comes down and then divides into its branches as the superficial and deeper branch. So that is with respect to some of the clinical findings in nerves. So sometimes they do present with loss of sensation over the extremities, some kind of numbness or tingling sensations, and sometimes in advanced cases they also do present with ulcers and deformities. So on palpation we feel enlarged cord-like thickened fibrous structures, and the common sites of palpation for the ulnar nerve would be behind the medial epicondyle, for the medial nerve just proximal to the wrist crease, for the radial nerve would be along the groove of the humerus in the radial groove, and along the neck of the fibula for the common peroneal nerve. Now moving on with what we see on ultrasound images of these thickened nerves. So here we have an image of a normal nerve with some visible dot-like structures within, which are in fact the fascicles, and we call it as the bundle of straws appearance. Here we see a thickened and inflamed nerve, so it is more rounded than the normal nerve, more hypoechoic, with a surrounding rim of edema, which we see as a hyperechoic rim. And within the nerve, there is loss of fascicles, so that's why we call it hypoechoic. And on Doppler, we see an increase in the vascular signal, suggestive of inflammation. This is a longitudinal section of an inflamed and enlarged nerve, which shows a fusiform enlargement with again increased Doppler vascular signals. And this is a thickened nerve with some septate structures within, which is indicative of fibrosis. So we also see here is a median nerve in a child, in fact, which is thickened and hypoechoic. This is a very rare finding. So it is that we don't see much these days. It is that of a nerve abscess. So it's basically a collection that we see on longitudinal section, extremely hypoechoic, and a collection of abscess, a collection of some fluid-like material within this foci. In this image we see the neck of the fibula, and we also see a thickened common peroneal nerve. We do see some bundle of straw appearance in this image. So these are the main ultrasonographic findings that we see in case of leprosy. Now the nerve definitely would need to be differentiated from other structures. So movement of the limb helps to differentiate a tendon from a nerve. Also, when we trace the tendon longitudinally, we do observe that it enlarges to form the muscle bulk. And Doppler helps differentiate arteries and veins from nerves. And lymph nodes, on the other hand, are more circular. They have a very fatty hilum, and they do not have much of the longitudinal component that we see in case of nerves. So this is how we usually pick up nerves on an ultrasound. And features like fibrosis and this fusiform enlargement are not very common to see, but we are happy to be sharing whatever we have picked up with you today. So thank you for joining us, and hope this video was of information and some use to those that have participated. Thank you so much. Thank you.